differing effects on lumbar disc pressure at various positions. Disc pressure and stress on the lumbar spine is at its lowest when you are lying flat on your back in the supine position. These stresses slightly increase as you move from the supine position to lying on your side. 100 kilograms of pressure is measured on the disc of the lumbar spine when you are standing in the upright position. When leaning forward from the standing position, the pressure increases to 150 kilograms. Holding a load and leaning forward in the standing position causes this pressure to further rise to 220 kilograms. A non-load-bearing position of sitting upright will place 140 kilograms of pressure on the lumbar discs. Leaning forward from this position then raises the pressure to 185 kilograms. And finally, the highest pressure that is placed on the disc of the lumbar spine occurs when you are in the seated position and leaning forward while bearing weight. The idea is to hold this weight closer to the body to reduce the pressure being placed on the discs. Intradiscal pressures associated with the seated positions and postural changes have proven to be greater in comparison to the same position performed while standing. Factors which may contribute to pain or degeneration within the lumbar spine.
There are several potential causes for sciatic nerve pain, but the vast majority of cases are related to disc protrusion and/or contraction of the piriformis muscle. To give you a better idea of how disc protrusions and the piriformis muscle can cause sciatic nerve pain, let's take a look at the anatomy. This is a front view of the lower spine and pelvis, and as you can see, there are nerves that are branching off from the lower spine and also coming out from the sacral area, and these nerve branches join together to form the large sciatic nerve. This is a side view illustration of the lower spine, and it's showing a vertebra with a disc above and below. The disc above is highlighted in red to show that it is protruding and inflamed, while the disc below is just to represent a normal disc. As you can see with the normal disc, there's plenty of space around the nerve. The disc is not pressing up against it, and there's lots of room around that nerve root that is going to eventually join together with other nerves to form the sciatic nerve. As you can see with the protruding disc above, the space around the nerve is narrowed by the disc itself, and in many cases there will also be additional pressure placed on the nerve by inflammatory swelling. So you get the direct pressure of the nerve along with added pressure that's produced by swelling. Now here we see a back view of the lower spine and pelvis, and as you can see, the large sciatic nerve coming off on the left here, and coming off on the right we have it cut off here so you can see the hip capsule that's showing over here. That doesn't have anything to do with sciatica, but I wanted to let you know what that was. Alright, so now let's talk about how the piriformis muscle can affect the sciatic nerve. And the piriformis is a muscle that runs from the sacrum down to the hip joint. And in some cases it will run over the top of the sciatic nerve, as we're showing here. It is actually lying over the top of the sciatic nerve, and it can cause pressure when it lies over the top of the sciatic nerve. In some individuals, the piriformis will actually be underneath the sciatic nerve, as shown here. And usually it doesn't create too many problems in this type of orientation because it doesn't really place any pressure on the nerve. But there is one other configuration that can occur in some individuals, and that is if the sciatic nerve actually goes through the center of the piriformis muscle, as we're showing here, in which case compression or contraction of the piriformis can really create a lot of squeezing on the sciatic nerve and create a lot of symptoms when it does that. I discuss how to determine the cause of your sciatic nerve pain in detail on other videos.